All right, let's jump right into a medical mystery. This is a story about how something super common can suddenly become, well, life-threatening. So, how exactly does that happen? How does a common infection just spiral into a full-blown medical emergency? Well, we're going to follow the clues in one patient's case to find out. It's a story about how a perfect storm of factors can turn a simple problem into a crisis, and more importantly, how doctors use cold, hard data to find their way through it. So let's meet our patient. We'll call her JS. She's 30 and she's 20 weeks pregnant with her first baby. An exciting time, right? But right now, things are pretty scary. She's in the emergency room, she's got a high fever, chills, and this really severe pain in her side. And here's where it gets complicated, her medical history. She's had recurrent UTIs, and she's also dealing with gestational diabetes. Now, you got to understand, these are not just little footnotes in her chart. They are absolutely critical pieces of the puzzle.
Okay, so her symptoms, they might sound pretty familiar, right? But in her situation, they're signaling a much, much bigger threat.
All right, time to decode the clues. Let's put ourselves in the shoes of the medical team. We're going to follow the trail of evidence, and that starts with the lab results. Okay, take a look at her vitals. This table tells a story, and it's a dramatic one. Her temperature? High. Her pulse? Racing. Her breathing? Way too fast. Only her blood pressure is holding steady for now. You've got 3 out of 4 vital signs practically screaming that her body is under attack. These are flashing red lights, telling us there's a serious fight going on against some kind of invader. And here is our first huge clue. 15.5 times 10 to the ninth per liter. Now, to put that in perspective, the normal range for white blood cells caps out at around 11. She's way over. This number is basically a blaring siren from her immune system. It's telling us it has sent out a massive army of fighter cells to battle a major infection that's raging somewhere inside her body. And if we break it down even further, you can see just how intense this fight is. Her neutrophils, think of them as the immune system's special forces for bacterial infections, are through the roof. Her C-reactive protein, which is a major red flag for inflammation, is off the charts. And yeah, you can see her blood glucose is up too, just reminding us that her gestational diabetes is in the mix, complicating everything. Okay, so this is it. This is the smoking gun. The blood work told us that a war was being waged, right? But the urinalysis, this tells us exactly where the battlefield is. We see positive leukocyte esterase, which means white blood cells are in the urine. We see positive nitrites, which is basically a chemical fingerprint left behind bacteria. Finding both of those, that's a slam dunk. It confirms the source of the infection is in her urinary tract. Okay, we've gathered all the evidence. Now it's time to connect the dots and name the culprit. It's actually pretty cool when you see how it all fits together. You start broad with the systemic symptoms like fever and chills that tells you the infection is affecting her whole body. Then you get specific with the localized pain in her flank, which points right at the kidney. The lab work confirms, yep, this is a severe bacterial infection. And finally, the urinalysis nails down the source. It's just a beautiful example of medical detective work. And all of that evidence points to one diagnosis: acute pyelonephritis. Now let's be clear, this isn't your run-of-the-mill UTI. This is a severe kidney infection. The bacteria have basically climbed up from the bladder into the kidneys, and that makes it a complicated, serious medical issue, especially in pregnancy. It needs to be treated, like right now. So you might be asking, why her? Why did this happen to JS? And the answer is, it wasn't just bad luck. It was that perfect storm we talked about. First, just being pregnant can make you more susceptible to UTIs. Then you add in her history of getting them before, and top it all off with gestational diabetes, which can mess with the body's ability to fight things off. You put those 3 things together and you've got the perfect recipe for a really nasty infection. All right, we have a diagnosis. Now it's a race against the clock. Time to launch the first line of defense. And the strategy here is something called empiric therapy. It's basically an educated guess, but a really smart one. The doctors don't know the exact strain of bacteria yet, but they know what usually causes these infections. So they don't wait. They hit it hard and fast with a broad-spectrum antibiotic. Think of it like calling in an airstrike on the general area before you send in the ground troops. You're trying to gain control of the situation immediately. But, as with any good mystery, there's a twist in the plot. The first plan doesn't always work. Yeah, there's a problem. Even with that powerful antibiotic on board, Jay is not getting better. Her fever isn't breaking, she still feels awful, and that is a huge red flag. It means the weapon they chose, it's not hitting the target, and they need to know why, like yesterday.
And then the lab calls with the answer. The culture results are in. They've identified the bad guy. It's E. coli, which is super common. But, and this is the whole story right here, this specific strain is resistant to the antibiotics they were using. The bacteria has basically learned how to defend itself against our first-line drugs. This is a massive challenge in medicine today. That initial airstrike was never going to work. But this new information, it is a total game changer. No more guessing. The lab report is like an intelligence brief. It tells them exactly which weapons will work against this specific enemy. So they pivot. They drop the broad spectrum approach and switch to a targeted therapy. It's like going from a shotgun to a sniper rifle. They can now use an antibiotic that they know will kill this bug.
Okay, so JS is on the right medication. She's finally starting to feel better. But the job's not done. The last step is making sure this doesn't happen again.
So her discharge advice is all about prevention, and these are 4 really key tips. First, stay super hydrated. That literally helps flush bacteria out. Second, urinate often and make sure you empty your bladder completely. Third, and this is crucial, practice proper hygiene. And finally, because she's high risk, she'll need to talk to her doctor about maybe taking a low-dose preventative antibiotic for the rest of her pregnancy. Simple steps, but they can make a world of difference. You know, when you look back, JS's story is it's an incredible example of modern medicine. It shows how a really scary emergency was solved with data, how an unexpected problem was overcome with more data, and ultimately how knowledge can turn a terrifying threat into something you can actually manage. So, what does a case like this really teach us? I think it highlights this incredible race against time that's happening every day in hospitals. It's a race between infection and information. And in a world with growing antibiotic resistance, having the right data at exactly the right moment, well, it's not just helpful. It can be the one thing that saves a life.
Thanks for joining this explainer.